Hi, my name is Dr. Karen Bender, and I'm here today to talk to you about pain and some strategies you can use to help minimize your experience of it. First, I want to say that there's two major components of pain. There's a physical sensation and also the emotional response to that physical sensation. To illustrate how your emotional response can actually increase your experience of pain, there was an experiment that was done. In this experiment, there was participants that were divided into three groups. In the first group, the participants had the experience of heat being applied to their arm. And while that happened, their heart rate was monitored as an indicator of their physiological response to that painful stimuli. Bear in mind, the heat was not so much that it caused any kind of injury or harm to the person. It was just enough heat to cause some discomfort. The second group also had that heat applied at random time intervals like the first group, but they had a bell that warned them a few moments before they experienced the pain. And their heart rate was also monitored to monitor their response to that pain. The third group was like the second group, but these people were people who had experience, at least a few years experience in meditation practices and mindfulness training. So the results were that the people who had no bell experienced no bell that was indicating to them that the stimulus was coming, would just have their heart rate go up when the heat was applied. The second group would have their heart rate go up whenever the bell was rung, and their heart rate would stay up elevated a little bit longer afterwards. In the third group, they did not have their heart rate go up with the bell when it rang, and it didn't stay elevated as long. So what this means is that the people who were trained to associate that sound with the painful stimulus were also having an emotional response. So even though there was no physical sensation going on, they were still experiencing heart rate elevation because they were anticipating that pain. There was maybe a component of fear that it was going to hurt, or maybe there was just a feeling of anger that they didn't have control over it. But the group of the people who had the same situation, but they had experience with meditation and mindfulness practices, they were able to uncouple the sensation of the painful stimuli with the bell. In other words, they were able to not emotionally respond to the bell, and so their heart rate wasn't elevated during that time. They were able to experience the sensation of the heat just as a sensation without the emotional input that otherwise would have increased their heart rate, as demonstrated by the second group. So overall, what this is just illustrating is that sometimes there can be things that happen to us that cause us to have pain, and our emotional response to them, our judgment about that pain, what does this mean to us? Why did this happen to us? And it's not fair that it's not happening to us, or all these different components, they can actually contribute to our experience of that physical pain and make it worse. So by learning to have some strategies where you recognize the sensation is separate from maybe your emotional experience of it, you can reduce your experience of pain. One of the tools that I use to help people learn this is biofeedback. It's just a way to help you get connected with how your mind and your thoughts, your emotional state affect your physiology and the other way around. So if you're interested in figuring out ways to help manage pain, I would love to meet with you and talk to you a little bit about maybe figuring out what is causing that pain, finding the root cause of it, addressing it, and also learning some skills to help you cope with and manage that experience of pain that is an inevitable part of life that comes and goes at different times. So to make an appointment, please call 860-674-0111. I look forward to seeing you soon.